NHS Fife has become the first health board in Scotland to carry out same-day knee replacement surgery. The procedure was performed at Victoria Hospital in Kirkcaldy. It hoped the move could bring major patient benefits as well as a cost savings for the NHS. Stephen McMenemy reports.
Craig Buchanan spent his career pounding the streets of Fife working as a policeman. But after retiring, he had constant pain in his knees. He had traditional surgery on his left knee last year, but now, just a few weeks after a new knee replacement procedure on his right leg, he's back at Victoria Hospital in Kirkcaldy to thank his surgeon.
Excellent work, thank you.
I feel like it's been a good benefit getting it done.
Consultant orthopaedic surgeon Sarah Mitchell carried out the first ever day case knee replacement operation on Craig at the end of November.
They get admitted at 7:30 in the morning. They generally go down to surgery around 9 o'clock, and then usually within 2 hours of their surgery, they're being mobilised in the ward and getting them up as soon as possible. Patients are getting up much quicker, and this reduces their muscle loss that they get after surgery, which is a known complication after having any surgery or being in hospital.
For Craig, the surgery has saved him from a life of pain.
The best way to describe the pain that was going through the right knee would be continually having toothache on it, with somebody rubbing sandpaper on it continually on the bone.
NHS Fife carried out the first day case hip replacement surgery in the last 12 months, and with hundreds of knee procedures taking place every year too, the new procedure could have major benefits for patients and the public purse.
The aim of doing this is to improve patient outcomes, improve patient care. Obviously, a good benefit side effect is that we can reduce the cost to the NHS and we can reduce the length of stay of the patient in hospital.
My idea would be to come in as soon as possible and get it done. The surgeon, Sarah Mitchell, you can't beat her.
In the future, it's thought around 15% of patients needing knee replacements could be eligible for the day case procedure. Stephen McMenemy, STV News.
Now here's Sheila with all of the day's sport and a big night at